Binge eating disorder, or BED, is a serious eating disorder. It's characterized by recurring episodes of binge eating. Binge eating involves consuming large quantities of food in a short period of time. Individuals with BED often feel a loss of control during these episodes. They may feel shame, guilt, or distress afterward. BED is not simply overeating on occasion. It's a complex disorder with significant psychological and physical implications. People with BED often experience emotional distress. They may also struggle with body image issues and low self-esteem. These struggles can significantly impact their quality of life. BED is more common than anorexia nervosa and bulimia nervosa combined. It affects people of all ages, genders, and backgrounds. However, it's crucial to remember that BED is treatable. With proper support and intervention, individuals can recover and lead healthy, fulfilling lives. Seeking help is the first step towards breaking free from the cycle of binge eating and reclaiming control over one's relationship with food. The causes of binge eating disorder are complex and multifaceted. They often involve a combination of biological, psychological, and environmental factors. Understanding these contributing factors is essential for developing effective treatment strategies. Biological factors may play a role in the development of BED. Studies suggest that genetics can increase an individual's susceptibility to developing eating disorders. Imbalances in certain brain chemicals such as serotonin and dopamine, which regulate mood and appetite, may also contribute to binge eating behaviors. Psychological factors are often intertwined with BED. Many individuals with BED have a history of trauma, abuse, or neglect. These experiences can lead to negative self-image, low self-esteem, and difficulty coping with emotions. Binge eating may serve as a way to numb or suppress these painful feelings, providing temporary relief from emotional distress. Environmental factors can also influence the development of BED. Cultural pressures to conform to unrealistic body ideals can contribute to body dissatisfaction and disordered eating. Exposure to dieting culture, weight stigma, and societal messages equating thinness with happiness can create a fertile ground for eating disorders to take root. Binge eating disorder often manifests through a combination of behavioral, emotional, and physical signs. Recognizing these signs is crucial for early intervention and preventing the disorder from escalating. Behavioral signs of BED are often the most apparent. These include recurrent episodes of binge eating characterized by consuming unusually large amounts of food in a discrete period. Individuals with BED often eat more rapidly than usual during these episodes. They may continue eating even after feeling uncomfortably full. Emotionally, BED takes a toll on an individual's well-being. Feelings of shame, guilt, and disgust are common after a binge episode. Individuals with BED may experience intense feelings of distress and self-loathing related to their eating habits. These negative emotions can fuel a vicious cycle of binge eating as a coping mechanism, further exacerbating the disorder. Physically, BED can lead to a range of complications. Fluctuations in weight are common, and individuals may experience digestive issues like bloating, constipation, or diarrhea. The strain of binge eating can also impact sleep patterns, leading to insomnia or restless sleep. Long-term untreated BED can have severe health consequences, including an increased risk of obesity, type 2 diabetes, heart disease, and certain types of cancer. Diagnosing binge eating disorder, or BED, involves a comprehensive evaluation by a qualified healthcare professional. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition or DSM-5, outlines specific criteria for diagnosing BED. According to the DSM-5, an individual must meet the following criteria for a diagnosis of BED: recurrent episodes of binge eating, characterized by eating an abnormally large amount of food in a discrete period, a sense of lack of control during the episode, marked distress regarding binge eating, and the binge eating episodes occur on average at least once a week for 3 months. Assessment tools such as the Binge Eating Scale, or BES, and the Eating Disorder Examination, or EDE, can be used to gather information about an individual's eating habits, thoughts, and feelings related to food and body image. These tools help clinicians assess the severity of the disorder and develop an appropriate treatment plan. It is important to note that self-diagnosis is not recommended, and seeking professional help is crucial for accurate diagnosis and treatment. Section 5. Seeking help treatment options for binge eating disorder. Thankfully, binge eating disorder, or BED, is a treatable condition. Various treatment options are available, and the most effective approach often involves a combination of therapies tailored to the individual's needs. Psychotherapy forms the cornerstone of BED treatment. Cognitive behavioral therapy, or CBT, is particularly effective in addressing the underlying thought and behavior patterns contributing to binge eating. CBT helps individuals identify and modify negative thoughts and feelings that trigger binge episodes, develop healthier coping mechanisms, and build self-esteem. Medications such as antidepressants and anticonvulsants can also play a role in managing BED. These medications can help regulate mood, reduce cravings, and minimize binge eating episodes. It's important to note that medications should always be used under the guidance of a qualified medical professional. Nutritional counseling is another essential component of BED treatment. Registered dietitians can provide personalized guidance on developing a balanced eating plan, making healthier food choices, and understanding portion control. They can also address any nutritional deficiencies and promote overall well-being. Support groups offer a safe and supportive environment for individuals with BED to connect with others who understand their struggles. Sharing experiences, coping strategies, and encouragement can be invaluable in the recovery journey. Section 6. Taking control, self-help tips for managing binge eating. While professional help is essential for treating binge eating disorder, there are several self-help tips individuals can implement to manage their symptoms and regain control over their eating habits. One crucial step is to identify and avoid triggers. Keep a food diary to track eating patterns and identify situations, emotions, or foods that often precede binge eating episodes. Once triggers are identified, individuals can develop strategies to avoid or cope with them more effectively. Practicing mindful eating involves paying full attention to the sensory experience of eating, savoring each bite, and recognizing hunger and fullness cues. This practice can help individuals slow down their eating, increase their awareness of internal signals, and break free from automatic eating patterns. Finding alternative coping mechanisms is crucial for managing the emotional distress that often underlies BED. Engaging in regular physical activity, practicing relaxation techniques, pursuing hobbies and interests, and connecting with supportive friends and family members can provide healthy outlets for emotions and reduce the urge to binge eat. Finally, self-compassion is paramount. Treat yourself with kindness and understanding, acknowledging that recovery is a journey with ups and downs. Focus on progress, not perfection, and celebrate every step taken towards a healthier relationship with food. Section 7. The unseen consequences. Health risks of untreated binge eating disorder. Left untreated, binge eating disorder, or BED, can have severe and potentially life-threatening health consequences. The physical and emotional toll of BED extends far beyond weight gain, impacting various bodily systems and increasing the risk of chronic diseases. One of the most significant risks associated with BED is obesity. The excessive calorie intake during binge eating episodes can lead to rapid weight gain, increasing the likelihood of developing obesity-related health problems such as heart disease, stroke, type 2 diabetes, and certain types of cancer. BED can also wreak havoc on the digestive system. The large quantities of food consumed during binges can overtax the digestive tract, leading to digestive issues like bloating, gas, constipation, diarrhea, and abdominal pain. The emotional and mental health consequences of BED should not be underestimated. Untreated BED can contribute to depression, anxiety, social isolation, low self-esteem, and body image dissatisfaction. The shame and guilt associated with BED can create a vicious cycle, further exacerbating these mental health challenges. Section 8. A beacon of hope. Recovery is possible. Binge eating disorder, or BED, is a serious condition, but it is essential to remember that recovery is possible. With proper treatment, support, and self-care, individuals with BED can overcome their struggles with food and live healthy, fulfilling lives. Recovery from BED is a journey that requires time, patience, and commitment. It's not about achieving perfection, but about making progress, one step at a time. Setbacks are a natural part of the process, and it's crucial to approach them with self-compassion and a willingness to learn and grow. Remember that you are not alone in this journey. Reach out to loved ones, join a support group, and seek professional guidance. With the right tools and support, you can break free from the cycle of binge eating, reclaim your relationship with food, and live a life full of joy, health, and well-being.